Flat feet are common in children. In fact, almost all kids have flat feet until age 3 or 4. You can recognize them by the low or flat arches as shown here, sometimes called fallen arches. Often, the heel tilts outward, as shown here. You can think of flat feet in two categories, flexible or rigid. The vast majority are flexible. Rigid flat feet tend to be more severe and more likely to need complex surgery. We'll focus on flexible flat feet today and return to rigid flat feet briefly at the end. Flexible flat feet can easily be repositioned into normal alignment. For example, if you stand on your tiptoes, the arch reappears as seen here, and the heel stops tilting outward, as seen here. In fact, flexible flat feet can be considered normal, just as feet with relatively high arches are considered part of the normal spectrum. They tend to be a little more common in boys and especially overweight children. Thankfully, flexible flat feet are usually painless and don't require any braces, therapy, or surgery. They also are not expected to cause issues in adulthood. However, they can become uncomfortable in some cases. When pain occurs, it is usually along the arch, or on the outside of the foot in an area called the sinus tarsi, as demonstrated here. Typically, the first treatment is arch supports. These usually relieve symptoms, but do not actually change the shape of the foot. Over-the-counter arch supports like these are inexpensive and usually just as effective as expensive custom orthotics like these. However, custom options may be worth trying if over-the-counter inserts don't relieve the pain. It's important to note that flat feet with a tight Achilles tendon, also known as the heel cord and demonstrated here in red, behave a little differently. If the Achilles tendon is tight, a stretching regimen, with stretches like this one, will often relieve symptoms. Though, like with arch supports, the foot won't stop being flat. Importantly, the foot must be inverted during this type of exercise to effectively stretch the Achilles tendon and avoid making symptoms worse. Unfortunately, there are rare cases when pain persists despite prolonged use of arch supports and stretching. This means it may be time to think about surgery, which usually involves cutting the bones to reshape the foot, as shown here and here. Bone cuts are called osteotomies, and there are a couple techniques that can be used. For example, different parts of the foot can be reshaped using the cuts shown here and here. In the past, surgeons have tried other approaches like lengthening tendons or fusing joints, but osteotomies have become the standard of care. The arthroresis procedure is popular among pediatrists and involves lodging a screw in one of the joints of the hind foot. However, there is not currently good evidence for this operation. We feel the risks outweigh the benefits and do not recommend or perform it. As mentioned earlier, rigid flat feet are a different situation. These deformities are often caused by a bone abnormality inside the foot. For example, a tarsal coalition is an extra connection between the foot bones. Or sometimes a bone called the talus is positioned up and down rather than in line with the foot. In other cases, there is an extra joint between some of the bones. These rare conditions require different surgeries than typical flat feet. Fortunately, most cases of flat feet in children are flexible, painless, do not require any treatment, and do not lead to problems later in life. And remember, even when pain develops, surgery rarely becomes necessary.